Here, we will demonstrate the intussusception technique to assist with removing kidney stone fragments through a narrow infundibulum when performing mini PCNL. We use the Karl Storz MIP-M mini PCNL set. In this particular case, the patient's stone was in the renal pelvis and was 2.8 centimeters in the largest diameter. We achieved access through a posterior interpolar calyx. We could not appreciate how narrow the infundibulum was on the CT scan or the fluoroscopy images. Here we have a long 15/16 French sheath, which is intended for supine PCNL, and a shorter 16.5/17.5 French sheath intended for prone PCNL. The 15/16 French sheath can fit through the 16.5/17.5 French sheath. There is some friction between the sheaths, but water lubrication and twisting allows the smaller sheath through the larger one. This can be used to access the renal pelvis through a small infundibulum when the original access is with the 16.5/17.5 French sheath, which is the standard mini PCNL sheath we use. As you can see in this video, we are well situated in the interpolar calyx with our 16.5/17.5 French sheath. The 12 French offset nephroscope can access the kidney stones in the renal pelvis. However, we cannot advance the sheath through the narrow infundibulum to get closer to the stones. This impedes our ability to remove the stones using the vortex effect based on Bernoulli's principle. Rather than traumatically advance the 16.5/17.5 French sheath, or removing the sheath entirely and replacing it with the smaller 15/16 French sheath, we prefer to use the intussusception technique. Here you can see us placing the longer 15/16 French sheath through the 16.5/17.5 French sheath under direct visualization, allowing us to get the smaller sheath past the narrow infundibulum atraumatically and right on the stone in the renal pelvis. As you can see, it greatly improves the vortex effect, allowing us to remove stones more efficiently and without a basket. The surgical time was 2 hours and 35 minutes, including placing a 5 French ureteral catheter cystoscopically and then flipping the patient to the prone position. The patient did go home later that day, totally tubeless, after removing the ureteral catheter and Foley catheter in the PACU area. Follow-up renal ultrasound at 1 month revealed complete stone clearance and no hydronephrosis.